Hello friends, today's topic of discussion is tumor markers. It is a very important SAQ for university examination and it is a frequently asked question in university examination. We'll discuss the topic under the heading of definitions, various samples taken for the measurement of tumor markers and what are the characteristics of ideal tumor marker and what are the different uses of these tumor markers, followed by their examples. This is a complete short note. So what is the meaning of tumor? Tumor means cancer or neoplasm. Cancer means it is a abnormal uncontrolled growth of the cell, that is known as cancer. So what is the meaning of tumor marker? The substances, specifically proteins. These are the proteins. Substances which are mainly proteins produced by tumor cells or produced by normal cells in response to tumor cells or tumor tissues and detected in body or detected in body fluids. They are known as tumor markers. Substances produced by the tumor cells or substances produced by the normal cells in response to tumor tissues and detected in body fluid by various methods which are available. They are known as tumor markers. They are associated with this cancer. What is the characteristic? They are associated with this cancer. That's why they are known as tumor markers. Which body fluids they are used for the estimation of these tumor markers? The first one is the blood. The important one is the serum or blood. Then urine. Then body fluids. Body fluid means ascitic fluid, pleural fluid, cerebrospinal fluid, synovial fluid, etc. And tissues, various tissues that can be taken for the estimation of these tumor markers. Blood, urine, body fluid and various tissues can be taken for estimation of tumor markers. Now what is the characteristic of ideal marker? What should be the characteristics of ideal markers? So it should be constantly associated with the disease, means specific for that disease. So what are the characteristics of ideal marker? It should be specific for that disease, specific for that cancer. Okay. Second, it should be sensitive enough to be detected by various methods available. It should be present in more concentration as compared to normal individual. More concentration when it is compared to normal individual. Specific, sensitive enough to be detected, present in more concentration as compared to normal individual. It should tell about the stage of the disease. It should tell about the stage of the disease or stages of cancer. It should tell about the stage of the cancer. Stage of the cancer means extent of tumor. How it is, how large it is. That is known as extent of cancer. Whether it is spread to local organ or distant organ, that is known as extent of disease or stage of the disease. So tumor marker concentration should be raised in proportion to its mass. Okay, that is known as extent of the disease. It should tell us about the stage of the disease. So these are the different characteristics of ideal markers. They should be specific for the disease, sensitive enough to be detected by the methods which are available. Then concentration should be more as compared to the normal individual, and they should tell about the stage of the cancer or stage of the disease. Got it? So these are the characteristics of ideal markers. Now what are the uses? Important uses of markers. The first one is it is used for screening. It is used for screening of the disease. What is the meaning of screening? Screening means early detection of cancer. Early detection help in curing the cancer. It is very, very important. For example, pap smear. The cervical smear, pap smear, it is taken for the screening of cervical cancer. Means before the start of the disease or before the symptom appears. That is known as screening. So it should be able to screen the population. So what is the uses? It is used for the screening of the disease or screening of the certain cancer. For example, pap smear. It is used for screening of cervical cancer. Mammogram. Mammogram, it is used for the screening of breast carcinoma. Second, diagnosis. Diagnosis. It is used in the diagnosis or confirmation of the cancer along with imaging techniques. Imaging technique means CT scan, MRI, PET scan, etc. So it should be used in the diagnosis of disease along with imaging technique, along with imaging and clinical symptoms. Along with clinical criteria and imaging technique, it is used for the diagnosis of cancer. Okay. For example, alpha-fetoprotein level. It is used for the diagnosis of hepatocellular carcinoma. Okay. So screening, diagnosis, then staging. Staging. Staging means extent of tumor. How large it is. Extent of tumor. How large it is. Whether it invades the local tissue or it spreads to the distant tissues, means metastasis. That is known as stage. It tells about the staging of the cancer. Okay. Then prognosis. Prognosis means course of disease. Prognosis means course of disease. Whether patient will improve, whether patient will worsen or it remains stable. That is known as prognosis. It tells about the life of the patient. Okay. So tumor tells about the prognosis of the disease. For example, carcinoembryonic antigen. It tells about the colon cancer. It tells about the prognosis of colon cancer. More is the concentration, prognosis is worst. Okay, that is known as it is used for prognosis of the cancer or prognosis of the disease. Then monitoring of patient in treatment. So therapeutic monitoring of patient can be done with the help of tumor markers. Then follow-up. Once your treatment is done, the regular checkup is done for the follow-up of the patient, and tumor marker helps in the follow-up of the patient. So in this way, tumor marker help in screening of the population, diagnosis and confirmation of the disease, staging of the cancer, prognosis of the disease, monitoring of the patient in the treatment, and follow-up of the patient, regular follow-up of the patient. These are the uses of tumor markers. Now coming to the example or classification of tumor markers. Tumor markers can be classified into oncofetal markers, that is oncofetal antigen. It includes AFP, that is alpha-fetoprotein, and carcinoembryonic antigen. These are the oncoproteins. Okay. Then carbohydrate antigen or cancer antigen, that is CA15-3, CA19-9 and CA125. These are the cancer antigen. Okay. Then various hormones are there. For example, ACTH, HCG, calcitonin, insulin, serotonin. These are the hormones which are useful in the detection of various cancers. Various enzymes, for example, alkaline phosphatase, neuron specific enolase, prostatic acid phosphatase and LDH can be useful in detection of cancer. So we'll see one by one. So So they are classified into oncofetal antigen, then carbohydrate antigen or cancer antigen, then hormones, these are the hormones, enzymes and various other markers or receptors or various other markers or molecular markers. Okay, so coming to the one by one discussion, alpha fetoprotein, it is a oncofetal antigen. It is produced during the fetal life. It is produced during the fetal life. Later on, the concentration of alpha fetoprotein decreases. In the adult life, it decreases. Okay, but whenever there is cancer of hepatic cell or hepatocellular carcinoma, or whenever there is germ cell tumor, the concentration of alpha fetoprotein increases. So alpha fetoprotein, it is used in the detection of hepatocellular carcinoma and germ cell tumors. Okay, second oncofetal antigen is carcinoembryonic antigen. Carcinoembryonic antigen. This antigen, it is useful in the diagnosis of colon cancer, lung cancer and breast cancer. It is increases in various cancers. Of these, most common are colorectal, breast and lung cancer. It is used for the screening, staging, monitoring, follow-up and disease prognosis. Carcinoembryonic antigen. So these two, alpha fetoprotein and carcinoembryonic antigen, these are the oncofetal antigens used for the detection of cancer. Now second one is this carbohydrate antigen or cancer antigen. 15-3, it is used for the detection of breast cancer. Then 19-9, it is used for detection of pancreatic and various intestinal cancer, that is colon cancer. Then CA125, it is used for the detection of ovarian cancer. This is important MCQs. Okay, CA125, it is used for detection of ovarian cancer. Then these are the carbohydrate antigen. Then various hormones, ACTH. ACTH, it is useful, the ectopic ACTH formation, it is useful in detection of lung cancer. Ectopic ACTH production, it is useful in detection of lung cancer. Beta HCG, human chorionic gonadotropins. Human chorionic gonadotropin, it is useful in the detection of choriocarcinoma. And various germ cell tumors can be detected by the HCG concentration. This HCG concentration also increases during the pregnancy. Okay, in normal condition, pregnancy, it also increases. Then calcitonin, it is used for screening of medullary carcinoma of thyroid. Calcitonin. It is used for screening of medullary carcinoma of thyroid gland. Insulin, it is used for insulinoma. And serotonin, it is used for detection. Serotonin, it is used for detection of carcinoid tumor. It is used for detection of carcinoid tumors. Then various catecholamines, they are used for detection of pheochromocytoma. Catecholamines, epinephrine. Catecholamines, it is used for detection of pheochromocytoma. It is tumor of adrenal gland. Okay, then various enzymes are there. They are used in the detection, monitoring, follow-up purpose. Example, alkaline phosphatase. Two important variants, that is liver and bone isoenzyme. Liver, it will be helpful in detection of liver metastasis, liver isoenzyme of alkaline phosphatase, while bone isoenzyme of liver alkaline phosphatase will help in detection of bone metastasis. There are also other variants, that is Regan, Nagao. These are the other variants which are also helpful in the diagnosis of certain cancers. Then neuron specific enolase. It is useful in the diagnosis of neuroblastoma. Nerve cell tumor. Then prostatic acid phosphatase. This enzyme, it is useful in the detection of prostate cancer. Prostatic acid phosphatase. Then prostate specific antigen. This is not enzyme. This is a protein. Prostate specific antigen. It is useful in the detection of prostate cancer, and its concentration also increases in benign hypertrophy of prostate. So these are the enzymes which are used in detection of certain cancer and used as a tumor markers. You can remember this topic as A, B, C, D, E, F, G, H. How? So A for alpha fetoprotein, A for alkaline phosphatase, then B for beta HCG, which is used for detection of choriocarcinoma, then C for carbohydrate antigen, cancer antigen, then calcitonin and carcinoembryonic antigen, C. There is no D here. D is there, that is des prothrombin. Des gamma prothrombin is there for D, but forgot it. So calcitonin, then nothing is for D. Then E for estrogen receptor and progesterone receptor. They are useful in the detection of breast cancer. Then G for gastrin, it is used for detection of gastrinoma. Then H, that is HER, HER2, it is useful for detection of breast cancer. It is important, HER2. It is useful in detection of breast cancer. Then LDH, it is used for the detection of LDH1. Specifically LDH1, it is useful for detection of testicular and germ cell tumors. LDH5, it is useful for LDH4/5, it is useful for the liver. Okay, it is useful for the carcinoma involving the liver. LDH4/5. Okay, so and prostatic specific antigen and prostatic acid phosphatase, it is used for detection of prostate cancer. So there are number of tumor markers of these. These are the commonly used tumor markers. They are used in the screening of the disease, diagnosis of the disease, staging of the disease, prognosis, then monitoring of the treatment and follow-up of the patient. So these are the uses of these tumor markers. So keep watching. Thank you.